to another dentist that he's a maxillofacial surgeon.
Oh, wow.
So it's very difficult to have the same office and work in the same things. So I began to work with children that he didn't like to work with children, and I love to work with children. But when we go to Chile to get his maxillofacial surgery, his grade, I knew this specialty. I didn't know it was so good, so special in the dentistry. Nobody in Central America knew about radiology. So I came 25 years or 26 years ago, and I began to promote myself, making other dentists understand what I should do or I can do for them with the radiology. At that time, the only thing we had, it was a panoramic X-ray and the intraoral X-rays. So I began with panoramic and 4 bi-wings and making the diagnostic about what I saw in the images and about caries. And it was very important for them. It was important for Costa Rica. I began giving classes at the university, at the faculty of odontology. And so radiology began to have a very different or very important, not different, importance that radiology didn't have in the past. So when I knew about tomography, I knew it was meant to be in Costa Rica, and I tried to find people that can make a group. It was very expensive, more expensive, very much expensive than is right now. So I found a group that understand all my goals about giving the dentists in Costa Rica a new tool that they can make better treatments. I began knocking door by door of the dentist offices, making an explanation of what was tomography. 8 years ago in Costa Rica, nobody knew, but not in Costa Rica, in the whole world, tomography was just beginning. So we bought the first equipment in Latin America, Morita's equipment in Latin America. The only country in America that had at least 20 or 30 tomography equipments was the US. In Argentina and in Chile. At that time, we are a group of radiologists in Latin America. We have an association. We work for the understanding and how we should give the knowledge in the universities. So we talk a language, a radiological language that should be very the same for all America, for all the world. The terminology of the name of the things, what we found in an image right now, what I write on a paper is the same words less or words more than a radiologist in the US, in Europe, or in South America, or even in Africa, in South Africa, for example. Radiology is a science. Radiology can give you images from photons, our radiology. We have photons that are created into a little tube in the machine, and right now everything is digital, and so a flat panel will receive those photons that cross through the mouth, maxilla and mandibula of a patient, and can give you images of what you can't see, making a clinical examination of the mouth. Even if the patient tells you some of the symptoms sometimes you can't find why that patient is feeling that, or why is that kind of infection in the mouth, and you need an x-ray just to see inside the bone, inside, and make the correlation about the clinical findings and the radiological findings, and make with both diagnostic. A lot of things, everything about dentistry, anything you can imagine, tomography is going to be useful for that. For example, right now, Digident participate in an investigation that had an Anaton Award. Anaton Award is something very special in investigation in the world. What we did in this moment was just taking the knowledge from a book about amelogenesis imperfecta, is an illness about people that doesn't have enamel on their teeth, and with the different types of amelogenesis imperfecta. And what we did with tomography was trying to correlate what the books told us and the images can give you. So right now we can tell that, for example, in this investigation, you can be sure that the tomography can find everything that is written since ever. Any Costa Rican people feel that they have the possibility to get the best treatment, because doctors should give him the best treatment. And that's when, for example, when I teach radiology at the university, this is a public university at the Universidad of Costa Rica, we teach them that every person that goes through your door should get the best of you, should get. And we are trying to teach them to make the best dentistry in the world, not in Costa Rica, in the world. All our teachers in the Universidad of Costa Rica are masters, doctors, PhDs, and right now we have a lot that the university, the country of Costa Rica, pay them to go to anywhere in Chile or Brazil or US or Europe to get their degrees, and to come back to Costa Rica and have to work at the universities so they can teach the best technology, the best way to be a dentist. I was very lucky because when I met the 3D images, I was working to Emmet, is a company in Costa Rica that brought panoramic X-rays, and so I went to Manrique Odio, the owner, the CEO of that company, and I thought, have you ever heard about 3D images? No, what is it? So he went to the computer and he began to, and asked the boy that worked with him with technology and computer systems or of his company, try to understand what's 3D images. So he just made me a call and he says, do you know Morita equipments? No. But let me ask. I ask my professors and they say, oh, Morita, the best images in the world. So we begin to just make this review about everything, and we found, and then he told me, well, right now, if you want to know Morita equipments, you have to go with me to Los Angeles and see, I don't know, an open where they were going to have these equipments, an exhibition, so we went for a weekend. I saw that, it was so expensive, I was, wow, so expensive, but I have to have it. I have to have it. It was something that get into here, my mind. So, some people, three dentists, knew that I wanted to have that. They called me, and we made the group, and we bought the kit, knowing nothing about tomography. So I went again to my group of professors. They were just as me, beginning buying new equipments from Korea, from Siemens or whatever, and they were just trying to understand what I was trying to understand the same. And this world began to just take the form. There's a big brother of this equipment.
Yeah.
It's called Aquitomo. Aquitomo, it was put in the market about 12 years ago or more, maybe more. Right now, 14 years. And only universities had this machine. With another one is Italian. They were just at the same time. I don't know why I forgot that. But it was like a tomography, a medical tomography. The patient should be laying down and had this gantry, and it was very different. And they just, Dr. Arai, he's about, I don't know, he's very young. He's a very good person. He's a dentist, radiologist, and also a physic. He made this equipment, making all the algorithms and everything, and he understood, and Morita, this company that is very old, they have 100 years already in the world, and they just, they do another things for dentistry and for medicine also. And then with Dr. Arai, they constructed the Aquitomo. It's bigger, you can have the whole head. But what I prefer this equipment because it was just the jaws, because I am not a doctor in medicine, and I was afraid that how can I make an information about other parts of the head or the neck that I don't know. I don't know how they function. I don't know anything about that. Even the pathology is very different. What I know is mouth. I am a dentist. So, as a dentist, I know what to do with the mouth. If you want or you need to make a very good investigation from what you see in the teeth and all the tissues around the teeth, you have to make the images with Morita. Point. Why? Because we don't work with pixels, we work with voxels. It's a whole unit of image that is pixel here and inside to the inside. It's a circle that's made of voxels all around, and that voxel it's is equally in the pixel outside, and the measures of that voxel is equal. It is a square, a real square. It's not a rectangle. And that makes very different images. Well, somebody told me, you are like a psychic. So I don't believe that that's the special word. But you're like a psychic. You can see in white, black, and gray colors things others can see. And that made me so happy because I love that spiritual part of what I do, that being with these girls we are a very united group, and I don't believe that Digident unite us. What we are united with each one of them in Loyosas, and with each one of them is more important than what is Digident, like this form of what we find inside. What we see in Digident is more spiritual. We have the same feeling, trying to help, doing our best for the dentist, and that makes us very different. I believe this is what makes us very different: attitude and passion.